The Mandarin Spoken Word Picture Identification Test in Noise Adaptive, or MAPID-A, was jointly developed by my team at the Education University of Hong Kong, Department of Special Education and Counseling, and the Integrated Center for Wellbeing, and also two collaborators in China, the Shanghai Acoustics Laboratory and the Chinese People's Liberation Army General Hospital, Department of Otolaryngology, Head and Neck Surgery. The goal of MAPID-A is to test very young children's speech recognition in noise. Our research results have proven that young children as young as 3 years of age could be reliably tested with a very short testing time of just 4 minutes. With such a short testing time for young children was not available before in the Chinese-speaking communities, and also very scarce internationally. MAPID-A can be used clinically in hearing clinics, hospitals, and schools to investigate young children who have concerns in listening, especially under noisy environments. For example, parents and teachers noticed that their children had more communication breakdowns in noise than their peers, and are not attentive in classrooms which are usually full of noises. MAPID-A is useful to identify children who are at risk for central auditory processing disorders, which is a subtle communication disorders where the neural pathway for listening is impaired. In addition, MAPID-A can also be used to identify children with transient or permanent hearing impairments. That means children with structural or physiological damage in their outer, middle, or inner ear. Lastly, for those children with permanent hearing impairments who need to use hearing devices such as hearing aids and cochlear implants, MAPID-A can also be used to investigate how they perform in comparison with their hearing peers. For example, those with normal hearing, and to offer evidence that if their current hearing device fitting parameters are offering the optimal benefits. When children are given more updated technology like noise reduction or other sound processing algorithms in their hearing aids and cochlear implants, MAPID-A can also be used to evaluate if those new technology are really offering additional benefits but not just mere marketing claims. Our research team has already published the results for the development of MAPID-A last year at the prestigious journal, The Public Library of Science. At this moment, a number of major hospitals in Beijing and other cities in mainland China are using MAPID-A to evaluate listening and noise performance in young children with hearing impairments. We hope to develop MAPID-A from the current research prototype version into a clinical version with more user-friendly functions, including instructions on equipment setup, testing procedures, and results interpretation, and also automatic report generation, so as to attract more frontline hearing health professionals to use MAPID-A. MAPID-A is also used to investigate the within participant listening and noise benefits of young hearing impaired children wearing hearing aids and cochlear implants in their 2 years, which is the very first study for the Chinese-speaking community. The results will be published later in the coming year. In the future, we would also like to see MAPID-A to be developed into other languages such as Cantonese, English, and Taiwanese for cross-language investigations on speech and noise performance in very young children.